My name is Saforn Him. I work at the Guelph Community Health Center. When I applied to the nurse practitioner program, I knew I wanted to be here at a community health center of some sort. The reason for that is I love the model. I was actually a patient of this health center, and so I knew exactly how it run and the things they provide, and I wanted to do exactly that.
My name is Irfan. I'm one of the nurse practitioners at the G&G emergency department. We look after all the emergency patients that comes through here, urgent or non-urgent.
So my name is Marie Greer-Kane, and I'm the nurse practitioner at Goderich Hospital, Alexandra Marine and General Hospital. I work in 3 areas here. I work in the emergency department, the mental health inpatient unit, and the prenatal clinic. I've been practicing here for 9 years, but been an NP for 10 years.
My name is Marie Rusnak. I am nurse practitioner at Greater Niagara General Hospital in Niagara Falls, Ontario, and I am a stroke nurse practitioner.
I worked in the hospital before, and I wasn't quite involved with ONA before. So when you're not involved, you often don't understand what is being done behind the scenes. What is the benefits? What is going on? How did we achieve this negotiation? But being a bargaining unit president, I see different. And I see the value in negotiations. I see the value in all of these. I really encourage nurse practitioners to get to know what ONA is really doing, because then they can understand that ONA is really trying to be that voice for them.
I think that there's a lot of education that we are successful so far in doing to bring people up to speed on what NPs do, what areas we work in, maybe some of our unique practice challenges.
The unionized system is extremely beneficial for the NPs and RNs. It puts you in that care of this union, saying that they're being looked after. Anything new that comes out gets dispersed to the RNs and NPs, whether it's new standards, whether it's new roles and responsibilities, and from stability-wise, the job stability, whether it's working in one place or a different place. If you're unionized, you have somebody you can rely on. I've had ONA, come in with conflicts, and they've dealt with it and things of that sort. So we always have a safe place that we can drop to and ask for assistance if it needs.
The NP role is coming around. It's still a little bit new, and there's a little bit of for lack of a better word, fear on the physician's part that we're going to take over their role. And I did encounter that the first year that I did this. Actually, in my specific role, I was the first in-hospital nurse practitioner in the Niagara Health System. So there was that challenge, okay. And I think if I hadn't been a member, there would have been a movement to remove the role. I persisted, and again, thanks to ONA for supporting the role.
The NP focus group that has regional representatives on it is so great, because then ONA is able to come to us and say, what's your experience? What are the unique practice issues that a nurse practitioner faces? Where can we improve? So once you share it, then I find that people are more willing to chat with you, to try and understand the issue, and then to work with you in order to come up with a solution.
If we were able to join and be together, we're looking at thousands, and it's one voice. That is something that the physicians have, which great for them for doing it, but something that we should do, because with that, we're able to tell people and also the government exactly what we need or what we want, which will also not just help us, but help our patients.